सीढ़ी बजा के बोल भैया
नमस्कार दोस्तों, मेरा नाम है संतोष अंबेकर और मैं हूँ नेचुरोपैथ।
तो दोस्तों आज हम देखेंगे रुजुता दिवेकर जी के स्पेशल डॉक्टर सीरीज के बारे में। तो चलो देखते हैं।
Hi everyone, and thank you very much for joining me on this really special series that we are doing with doctors. It's called the Insta Live with Doctors for Good Health. Now, we often think that I have no idea what this doctor is all about, and should I be asking my questions or should I not be asking my questions? But I decided to bring you doctors that you can wholeheartedly rely on. They'll hear you out, they'll educate you, they will make you aware without raising your fear quotient, and they'll ensure that you're in good hands from the beginning to the end. I'm extremely excited, delighted, and privileged to announce that the person who starts this series is someone who's extremely close to my heart. He's a Dil Ka doctor, he's internationally acclaimed, and I'm so super happy that he's decided to join us. His name is Dr. Sai Satish. I'm sure a whole lot of you know about him. When I first announced that he's going to be the one who will start off the series, I have been flooded with questions for him. It's been a crazy ride. Doc, if you're watching already, I do want to tell you that you have a huge fan following, and everyone wants to know, what would you like to recommend in terms of heart health, how we should be living our life, what should we be eating. And for all of you who are interested in knowing exactly what he's all about, Google him, because if I start talking about everything that he's done and achieved, I think I'll spend the next half an hour doing that. And if you actually let me talk about him, I think I can talk about him for the rest of the day. So I'm going to invite him in just a short while. I also want to tell you that, we have listed out all the questions that you have sent, and we are going to be taking each one of them. And yes, I am going to be saving this Insta Live. Don't worry at all. You'll be able to access it from my Facebook, from YouTube, from every possible place. All right, Doc, I just sent it to you. Okay, I'm able to see all of your questions, and I'm just waiting for him to join. Just give it a moment, All right. Dog, I do know that you're on, so just accept, or you send me an invite and I can make, I could accept it. Okay, while we are still talking and while we are waiting for Dr. Sai Satish to still join us, I want to tell you something about the heart. I'll tell you what I know about the heart. I do know that when you're doing something special, it starts racing. Mine is racing right now. Mine is pacing. Where's my dog? Why hasn't he joined yet? I do know he's online. That's one thing that the heart does. The other thing that the heart can do is that I think it can fall in love. Yeah. And when it is in love, it will start pacing at an even faster rate. I'm going to ask the doc if my information about the heart is actually true. I also know one more thing about the heart, that it is probably the first thing that is born. So right from even before the time that we are born, our heart is actually born. So we are all really born out of our hearts in that sense, because right from the time that you're 6 weeks pregnant, you are able to see your heart. So, all right, doc. Waiting again for you to join. I'm sending you this request one more time. Okay, I'll tell you one more name that Dr. Sai Satish has. He's also called Dialogue Raja. You will soon know why. Because he will crack so many dialogues about the heart that they will stay in your heart and head for the rest of your life. You will no longer see your heart as something that you should be worried about or scared of, but something that really, really helps you in your life. Okay, hey, he's saying hi to me. Yeah, all right. I'm calling you and, helping you sign up. In the meanwhile, okay, it is now saying that okay, fine.
Hey, sorry guys, you won't believe this. I am so sorry. You won't believe this. I actually put myself in aeroplane mode so nobody disturbs me with calls, and that didn't allow your request to come through.
All
I am
right.
so sorry.
No
There I am.
problem, no problem. You're looking leaner,
Hey,
fitter than ever before.
thank you so much. Thank you for the generous introduction. It's a pleasure to be here with all of you. Hello, everyone.
Yes, we right now have about 1,700 people joining us live, and they are going up in numbers because, it is actually illegal to be a cardiologist and look this good. Did you know that?
You're making me blush. You're making me blush.
I'm serious. I'm serious. Well, you are all about like preventive heart care. I know about that. I do know that you believe in a good, healthy lifestyle. You want people to stay fit. But I want to know why you're interested in people keeping fit. Won't you make lesser money if actually more people kept fit?
My God, Rujuta, I tip my hat to you, going
Why?
straight for the question that most people would be skittish to ask after a long conversation. And look at the way you just jump right into it. I see you don't mince your words or your food. Okay.
Yeah. Yes.
Okay. So here's the thing, right? I think doctors don't actually make money out of people being sick. I think doctors make money from giving good advice. Okay.
Awesome.
So here's the thing. It always starts with live better, eat right, exercise. And when people don't listen to you and they do get sick, someone has to be there to look after them. Rujuta, heart disease is devastating. It's heart-wrenching to have to go out and tell a young family that someone they love is having a heart attack. Any day of the week, I'd rather give health advice and champion preventive health than do that. And you know what? You know why I go after it the way I do? I go after it because when you hear a doctor, okay, saying the same thing your spouse, your grandparents, your mother, or somebody you love is saying to you, you just might take it a little more seriously. And that's why I love being on shows like this. Because even if 10 family members, even if 10 people take what we advise them seriously today and change their lives, 30 minutes is well spent.
Yeah, of course, of course. No, I do feel this all the time that, when good advice comes from a doctor, it goes straight to the heart. And which is really why it is so important that our doctors give us good advice, which is also why I really welcome this move of, of people like you, people that we can completely depend on, willing to be online, because I do know that not too many people in the medical profession are wanting to be online or, on maybe an Instagram live. Sometimes it can come across as something which is not brainy enough for a medical professional, So thank you for doing Insta live.
It's my honor to be here with all of you.
No, not at all. It's our honor, it's our privilege. And, like I said, you're really, really looking good. And it's so good that you're all for prevention of heart health. Tell us something about the heart that we don't already know, because, before you joined, I thought I must give my 2 cents on the heart. So I said, okay, dil zyada dhadakta hai when you are in love. Now, is that correct? Is that scientifically correct? That's just like,
First of all, I want to apologize for being 4 minutes late. I wanted to I feel so bad. I usually come early and I wanted to be on time. So I put my phone in sleep mode and your request was not coming through. And anyway, I'm glad I'm here. So, does your heart beat faster when you're in love? Well,
Yeah.
my simple answer is, of course it does. Tell me which one of us haven't felt our heart racing in the center of our chest when that special person is near us? There's a scientific explanation. See, your brain has a small area called the love nucleus. This
Oh,
love
it
nucleus,
does?
it does.
Wow.
Okay, it's actually called accumbens, the love nucleus. It's a funny name. Okay, so the brain has a love nucleus. It controls happiness and satisfaction and that feel good feeling you have. This sends signals to the adrenal gland, which is a tiny little gland over your kidney, which pours your blood with catecholamines. These catecholamines are called, you know what you call the adrenaline rush? They make your heart pound every time that someone special is near you. Okay? Now, there have been studies that show that it's not necessary that you feel this way only when you're newly in love. There have been studies that show that people in love, even after 20 years of marriage, yes, their brain shows the same activity when they're with the people they love. Not only that,
Wow.
marriage has been shown in a study to improve longevity about 7 years in men and 2 years in women. I think it's because we men give you a lot more stress.
I was just going to ask you that. I was just going to ask you that.
So,
Why does it give men better health and women poorer health?
that's because all of you are always looking after us. We are the most selfish of the two species. I shamelessly concede. But,
Oh,
but if you even look at the longevity data, there are certain areas called blue zones. And these blue zones are where people effortlessly live to be 100. And not just poor quality of life 100. I'm talking about good quality of life 100. And one of the key things they found is social integration. So whether you get love from a spouse, from friends, from family, or from pets, it's extremely important to have love in your life, feed off it, and live happy and healthy.
awesome. That's really good. Do you think food is also one of the ways of finding love, providing
Uh,
nurture, you know?
you know what? It's interesting you should ask me this question. One of the things I love about what you say, okay, is that everybody today is obsessed with a diet, right? There are 100 diets, dime a dozen. And I want to tell all our viewers that all the diets work. But what you preach is if you eat what you love in moderation every day, what is diet? Diet is just what you eat. Then you don't have to have a cheat day. Every day is a cheat. It's your relationship with food. And that's incredible, Rujuta. That's something I really laud in what you say. So yes, of course, food is an integral part of your life. And if you love your food and you eat right, and then you'll get your love for life and your good health.
No, I do know that, one of the ways in which your patients shower their love on you is with the biryani and the keema and stuff like that. So, what do you have to say about that?
So I believe there's a clear distinction between everyday food and festive food, right? It's not how it's not how well you live, but it's also how long you live. Or it's not how long you live, but also how well you live. So there's no fun if you remove all the fun out of life. And I'm never going to be caught saying that you can't enjoy your biryanis. As long as you,
Awesome.
and you should eat without guilt. Why should you, right?
Wow,
Make up
amazing.
for it. Make up for it. Do that extra 30-minute walk. Move around a little. You don't have to have a fixed time to walk. Be more active. Just walk more. Just being more active reduces your chance of cancer, lung disease, diabetes, heart attack, stroke. And this is not me. This is the 2019 American College of Cardiology and American Heart Association guidelines. They just say move around. You live longer.
That's awesome. We spoke about what love does to the heart. Now that you're talking about, when you're eating food, don't be guilty. Tell me what guilt does to the heart. Does it do something special? Does it shrink it inside?
आप आज मेरे को फंसा के रहेंगे. Okay, so emotions. Will you believe that now they've developed a scale for social stressors that actually affect heart health?
Oh.
Are you feeling happy on 1 to 5? Are you feeling stressed on 1 to 5? So emotion, see, the heart and the brain have been intimately entwined from the beginning of time. All right? So the happier you are, the longer you live. The more you laugh, the longer you live. It's the elixir of youth and life. There's a beautiful saying, there's a beautiful saying be careful of what you do, because ultimately you can't hide from yourself.
Yeah.
And what you take back to your maker is the soul with all your experiences. So have good experiences. So don't do things that you will be ashamed of, that you feel guilty, and life will be simple.
Awesome. Awesome. Great. See, that's why you're called Dialogue Raja. Cool. You've been talking about activity, and you just said that, there is research to show that, activity is good for you, prevents cancer, heart health, most of the lifestyle diseases and stuff like that. We also now have WHO recommending strength training or weight training at least 2 times every week. I do know that you lift weights. I also know that you believe in weight training, but still, there are a whole lot of people who feel scared for their heart if they go to the gym. What would you like to say to them?
Okay. First of all, it's not just the WHO. The guidelines that most cardiologists follow is the American College of Cardiology and the AC and the AHA guidelines. They are categorical. Recommendations for men or adults. Recommendation for adults is 150 minutes of moderate activity aerobics, 75 minutes of intense aerobic activity, and at least 2 days a week of strength training. Now, I swear by strength training. Okay? The biggest treasure you have is your lean body mass, is your muscle and your bone density. It's your gold. Now, you'll be so surprised to know that as you age, you can say, Doc, I've weighed the same the last 10 years, but you're slowly replacing muscle with fat. And unless you're strength training that muscle, it's going to degrade. Do you know that if you're regularly exercising, in just 36 hours, you're actually breaking down muscle at a cellular level, and in 3 weeks, you can physically see it. So it's very important to strength train. Now, on the question as to why doctors are skittish about recommending it, strength training is not something like a prescription where you have a dose and you can give it. It's highly individual. And there's a big propensity for misuse. You don't want somebody going to the gym and pushing 40 kilos, 50 kilos straight away. I'm 6'4" tall at 90 kilos. Do you know when I started chest pressing, I used 5 kilo dumbbells. I never go up on my weight till I can do 15 reps, 3 sets comfortably. So it requires consistency, approach it scientifically, systematically. It will hold you in great stead for the rest of your life.
How much are you pushing now?
Maybe 60, 70.
See?
But it takes time. It takes time, and you got to work at it. And it's so I have a nice line for this, right? Since you call me Dialogue Raja and laid it out there that I'm Dialogue Raja, okay? What gets you started is motivation. What keeps you going is habit. So build good habits.
Awesome. Really good. So what you're saying is that you endorse strength training, but
Absolutely.
You want people to follow the right technique and not do too much too soon.
Too soon. You got to build into your strength training. And when you have muscle, not only do you burn fat while you're exercising, the muscle will burn fat throughout the day. And the beauty is that your body will tolerate your biryanis and your small indiscretions even better, because you have a machinery of muscle breaking it down.
Yep. You get more metabolically efficient.
Correct.
Yeah. You also start looking better as a side effect.
I think so. It's a great side effect.
It's a wonderful side effect. Do you think it helps you with your day-to-day functioning and work also? Just the fact that people are keeping fit. Do you think they would get more functional, more productive?
Absolutely. You know what? Just exercising improves memory, improves mood, improves efficiency, improves performance. And not only that, like even in my line, it's quite physically exhausting. Sometimes I go 8 hours, 7 hours on a single case, and I'm operating with a 15 kilo lead suit to prevent me from the radiation because I'm in the cath lab. When I started strength training, it changed my life, because you're so much stronger and you're so much more physically capable of doing what your job requires of you. And I'm sure it will translate to any field you're in. You'll feel better, you'll feel lighter, and you can take life on with the zest that you should.
Yeah. Wow, that's amazing. 8 hours of work at one go, improved with
sometimes.
Yeah, that's crazy. Sometimes. That's crazy. What do you feel about this whole thing when you see life so up close and personal? Because I do know that so tell us something that you tell your students, about about the heart and about how you deal with people and the diseases that they have, about the things that they bear in mind when they're dealing with their patients, you know. So tell us what keeps you going, because this is tremendous to just work on one case for 8 hours. It's crazy.
So, most of the time I tell my students, everything you want to know about cardiology, you can find in books. But what I'm going to tell you is the finest qualities a doctor can have are passion, common sense, and compassion.
Kya baat hai?
Okay?
Superb.
Because passion will never make you feel like you're working a single day, and it'll drive you to excellence. Common sense will get you out of 99% of situations you're in. That 1% you can refer to those geeky, brilliant guys. Okay? Okay, no offense to the geeky, brilliant guys, of course. Okay?
That's offense to you only, na? They'll be referring it to you.
I walked right into that. and without common sense, neither passion nor without compassion, neither passion nor common sense mean anything. Compassion should be the pillar stone of your practice. And it's a very simple message I tell them, Rujuta. All you have to do is treat every patient like they are somebody you love. It's that simple.
Wow.
If your father or your brother is sick, wouldn't you call your colleague and say, listen, what do you think we should do? Then why the hypocrisy for your patient? Don't be shy. If you treat every patient like it's somebody you love, your choices become simple and your heart is as light as a feather.
Wow. I can already read in comments saying we need more doctors like you. When is that going to happen? You need to increase the number of training sessions that you're having. No, because do you also think passion, common sense, and compassion could also be a good formula for success? Because we do know that you're extremely successful. You're the best that we have. You're the best in the world. And what still keeps you going? Like,
I know. I'll tell you.
Like a child around
Like a
your
child, yeah. You know what? Even 20 years doing what I do, right? I still come home tap dancing.
Wow.
My wife Kritika asks me, how can you wake up so happy to go to work every day? Right? And it's quite simple, no? At the end of the day, we have to understand that the greatest honor a family can bestow on you is entrust the care of somebody they love to you. We're not doing them a favor. It's an honor. It's a privilege. And when you take that seriously, life becomes great and it becomes fun. And if you love what you do, you don't have to work a single day for the rest of your life. Another dialogue.
Well, I guess for everyone who's going, oh, do these doctors really exist? Are you for real? Well, he's also on Instagram, so you can just follow him and get all of his advice and the good vibes. And truly, I mean, one of the things that I truly respect about you is the fact that you put the person way ahead of just reports or parameters, because I remember you telling me that there's much you can't see a report and freak out. You also have to know how the person is doing, and is physical examination, is knowing a person that important, and is medicine overall taking adequate care to do that, or are you one of the only ones who does that?
No. So I don't want to say I'm the only one.
But you're surely amongst the rare ones.
But I'll tell you one thing, right? To your question on why, so there's a beautiful line. I'll start with a dialogue. Okay,
Done.
if you treat a disease, sometimes you win, sometimes you lose. But if you treat a person, you always win, no matter what the outcome. Patch Adams.
Oh, awesome.
So this was a movie I saw in 1998 in my final year of med school, and it had such a profound impact on me, right? And I always tell my students that it is not possible for my patient to be feeling better and the reports to be going worse. See,
wow.
Rujuta, yeah, it's not possible. So if you focus on treating people, the reports and everything else will fall in place. Now, just think about it. No two people are alike, Rujuta. Every single, even the same disease manifests differently in different people. Every person is a unique entity, emotionally, mentally, and physically. And you have to be able to realize that, and then you'll get them healthy and well as quick as you can.
Wow. So do you feel just as good like the way you felt the first time when someone got better under your care, or do you feel even better now?
I feel just as good. I'm like a schoolboy with his favorite lolly in his hand. Every time, every time my patient gets better, I'm like it's just incredible. Absolutely, I should make up one dance each time.
Yeah, you should. You should. You really
No, I
should.
just
All right. Before we take questions from the viewers and stuff, in fact, there are also a few requests for blind dates, So I'll let
uh-huh.
you deal with that, but
The ladies are taking the Dilka doctor too seriously.
very seriously, Dilka doctor, Dhak doctor. No, seriously. I mean, if you just read the comments, I don't know if you can see them.
Uh-huh.
You've touched everyone's heart, and I promised them that he'll
Hey,
crack so many dialogues that you'll
hey,
remember them for the rest of your life.
I just want to say one thing, okay, before we take questions.
Hmm?
Since there are so many lovely ladies in the audience, this is
Hmm.
something important that I want to get across, okay? Ever since the ever since the Industrial Revolution, the roles were defined. This 8-hour workday was defined, where men would work and women would stay at home. Isn't it so regressive that this many years later, we haven't questioned it? Think about it. People will say that, no, it's so much better for women now. And I don't agree with them because any family I look at, I always focus on the woman's health. Because
Wow.
if I get her healthy, I guarantee you the rest of the family will follow suit and be healthy, right? Think about
Awesome.
it. Women are juggling work, deadlines, family, uh, children, pets, and there are these men and all of us who just say that oh, we laud these super women. It's about time we stopped saying they're super women and actually took some time to tell them to invest in their health
Fact.
because they're always putting others at priority. They're always putting their job, their deadlines, yada yada, and they just don't have time to look after themselves. And it's important that all of them stop, catch a breath, focus on their health, and get happy and healthy.
Super, super. You'd
Now I'm all
already
yours.
won our hearts. Why did you have to say this? You know?
No, it's important that I truly believe it. It's close to my heart, like I
Oh,
would say.
absolutely. I mean, I totally agree too. Uh, Gender plays a huge role in health outcomes. And I always feel this that, if when we build more gender neutral kitchens, we will have healthier, happier families, societies, countries, everything. So I think a lot for men to do it and, to do their bit. And no one better than Dr. Sai Satish to really ask them to do this. So you won women, you won men, I think, with this. Well done. Because no, truly, because otherwise it's like this kind of advice is only coming from women, hardly ever from successful men. So this is huge. This is huge. Thank you very much for this. Do you have uh, is there anything like an ideal patient? You know?
Okay. I should have known better about the questions when I agreed to do this with you. Okay. Okay. So brutally honest, direct, bang. That's it. Okay. So here's the thing. It's like asking me, is there an ideal human being? Okay. People bring themselves to their doctor when they're most vulnerable. They're
Yes.
sick, they're scared, and they're uncertain. All right?
Hmm.
Haven't you heard doctors make the worst patients? So, so I don't think I can be an ideal patient. Okay. And when you think about where they're coming from and when you put yourself in their shoes, I think every patient is an ideal patient. Some just need more of your time, some need less of
Hmm.
your time, but you have to understand that it's an honor that they trust themselves on you, like I said before. And when you think about that, everyone looks ideal.
Wow, look at you. Cool. No, this is super. And I also want to say that this is not just a dialogue. I do know that you live by
Yeah,
this, you know,
I do.
which is really, really wonderful. So I'm now going to go straight into the questions that we've been receiving. Are you okay with that? Like I
Oh,
said,
I'm all yours. I
thank
just saw a
you.
question saying, is heart disease genetic?
Yeah. Would you like to
So,
take that?
of course. So, you know what? Everyone is obsessed with telling you that if you're Indian, you'll have heart attack 10 years earlier. If you're diabetic, you'll have heart disease 5 times more than a non-diabetic. My, I'm not disagreeing with all that. Yes, heart disease is genetic. But why worry about the things you can't change when you can do so much about what you can change? You can't change your gender. Men have more heart attacks than women. You can't change your genes. You can't change growing old. So what can you do? You can stay fit. You can eat like Rujuta tells you to eat. As many colors as you see in nature. Eat. And I love this line of hers. When I asked her once, right, about how many meals I should eat, she said you have to eat at least 6 times a day, 3 full meals and 2 in between. I was like, what? And then I said, Rujuta, you want me to eat like a child? And she nonchalantly looks at me and says, Doc, which are the healthiest of our species? And they're children. It's so basic, right? So eat well, exercise, be slim, and change the things you can. Don't worry about the ones you can't.
Yeah. And if you have a heart problem, talk to a doctor like this. Talk to Dr. Sai Satish, who can put you at ease. You know, seriously, if I ever have heart trouble, I'm coming to you. You know that, right? I've told you that already. I want to be on your table.
You have too good a heart to ever need me.
Never know. You never know. You know, like I say, you're doing everything that you can. That's what you ought to do. But, you know, if there is ever any trouble, you're my guy to go to, say, right? You know that.
So sweet.
Huh?
You're so sweet.
You know that. All right. I have this one question because, you know, we put out your story. Beautiful picture, by the way, but you look even better on the live.
I owe some of this good looks to you. Thank you so much.
Thank you very much.
You changed the way I eat food, and now every day is a cheat day for me, thanks to you.
Awesome. I'll take all the credit shamelessly. No. Thank you. You know.
So I'm all yours. What's up?
All right. So yeah, what I was saying is that we put out that story saying you're going to be live at 5 p.m. and in less than 20 minutes, we have hundreds of questions for, you know, about the heart and about various things that people want to ask you. And while I can't do justice to all of those questions, I've kind of picked a few which I think resonate with what many people are thinking right now. And here's one from Pooja Chaudhary, who says, in current times of mental stress, because, you know, COVID has brought in its own stresses, people losing jobs, sick, ailing parents, blah, blah. How can one keep the heart healthy? What can you do right now to keep the heart healthy?
First of all, simple things. The biggest, I tell my patients, if you can diet and lose weight in COVID times, you can do anything. Because one of the commonest, think about it, one of the commonest reasons you eat is because of boredom. Right? So when you're sitting at home, the simplest mantra I can give you is be more active. If you are working from a laptop, 10 minutes, sit down. If you have 1 flight of stairs, next 15, 20 minutes, climb up, work upstairs for another 30 minutes. Move around. That is one. Second of all, carve out 10 minutes in a day doing something you love. Like maybe it's reading an Archie comic. Okay? Maybe it's watching Tom and Jerry. Now you know how old I really am when I'm talking about Tom and Jerry and Archie comics. Okay? But pick that Friends episode that you like to see. Take 10 minutes and keep it for yourself. You'll be amazed at what a difference it'll make to your life and your mood.
Awesome. Great.
So active, eat healthy, and your heart will be fine.
Stay active, eat healthy, and you'll be fine. And do something that you love doing, even if it is silly, like reading Archie comics or watching an episode from Friends.
Especially if it is silly.
Especially if it is silly. That's good. That's good. That's advice from a good doctor. Do things if they're especially silly. That's really nice. Okay. Can people who have had heart attacks exercise?
Absolutely.
Should they exercise at all?
Absolutely. So I keep telling all my heart attack patients, okay, and there are quite a few. I keep telling them you have 2 birthdays. The first was the day you were born. The second is the day you walked out of the hospital with your heart attack.
Kya baat hai?
And you start your life fresh. Now, depending on how severe the heart attack was, how quickly you got to the hospital, and how good your heart function is, your intensity of exercise will vary. It will vary from having even if you're dealt the worst case scenario, you had the worst heart attack and have a low heart function, nothing will stop you from walking 30 to 40 minutes a day, right? Walking is brilliant exercise. Okay. Now, if you have normal heart function after your heart attack, whether you've had one stent or one bypass, it doesn't matter. The reason why years back, I shattered all these delusions of grandeur that I actually prolong life. I don't. I only improve quality of life,
Fab.
right? So even if you've had that heart attack and you've had a bypass and your heart function is normal, you should go at it as it's the first day of the rest of your life. But it's all the more important to prepare an exercise regimen, meet your doctor, have him bless it, and strongly recommend have somebody with you when you're training until you get fit enough to be on your own again.
So you would say it's good to invest in a good trainer, in a personal trainer.
Absolutely. And I think it's all the more important you exercise after your heart attack than before, Rujuta. I think it's all the more important. Cardiac rehab is terribly understated, underexplored. It should be a pinnacle of care.
Fabulous. Damn
Good questions.
Oh, you should thank all of the ones who have been asking, okay?
Keeping me on my toes,
There's Meenakshi Datta saying, I've been on aspirin. This is a little technical.
No problem.
I've been on aspirin 81 milligrams for several years. Can I take 75 now because 81 is out of stock?
Meenakshi, first of all, I'm going to do the most awkward thing that I have a license to do seamlessly. How old are you?
I have no idea.
Okay, so depending on, I don't know why you're on aspirin, but if you take 75, the short answer, 75 is fine without 81. Do you want to know why 81 milligram came? Because they did a bunch of studies. No, you don't want to know?
No, I want to know. Yeah.
They did a bunch of studies.
Do you know why there is 81 milligrams?
They did a bunch of studies and they found that any dose above 80 had the same beneficial effect. So they made 81 milligram aspirin. It's data companies in America. But I am absolutely certain you'll be fine with 75 milligrams, Meenakshi.
Fabulous. Great, Meenakshi. There you get it. Is it normal to have palpitations at menopause?
Yes, it is. Okay. So first of all, what is palpitation? An uncomfortable awareness of one's own heartbeat. That's the definition of palpitation. There is physiological palpitation and pathological. When you run up a flight of stairs, even fit people will feel the heart pounding. We actually like it. That's physiologic palpitation. Like she asked you, have you ever felt your heart racing when somebody you care about walks past you? That's physiologic palpitation. Abnormal palpitations are when the palpitation makes you very uncomfortable. It is not precipitated by any activity. And when you start getting blurring of vision or lightheadedness when you're having it, you need to see a doctor immediately. Those are danger signs that your heart is beating so fast. It's all common sense. Your heart is beating so fast that not enough blood is going to your brain. So you're feeling woolly in the head. Then you got to see your doctor. Now, during menopause, you're going through a physiological storm of hormone changes, right? And your body's adapting to this metamorphosis. It's perfectly normal to have palpitations. If it becomes too uncomfortable, see your doctor, and I'm sure they'll be able to fix you.
Wow, that's a great answer. I think most women will stop having palpitations just after listening to this. No, really, this is wonderful. This is wonderful. There are people who exercise and then they have like a low resting heart rate of like 60, 50, 48 sometimes, the ones who are training hardcore. What would you like to say to them? Is it okay? Because a lot of times people feel like 70 or 74 is like normal heart rate, but if you're training regularly, it drops.
It's a great question. Even today, so many times people will get referred to me saying, his heart rate is only 45. And then, so this is the thing. Normal heart rate is from 60 to 100. Over 100 is tachycardia, less than 100, less than 60 is bradycardia, or low heart rate. Now, when you systematically exercise regularly, you get your heart used to performing at a higher level, right? So what happens is, over a period of time, your heart says, look, I'm so used to working when you're training me that in your day-to-day activity, I have to just beat 40 times a minute. Go, you're boring me. So that's what your heart is doing. So your heart actually has to work less at normal, and it only has to really kick in. So you improve its contractility, you improve its pumping, you improve its efficiency, And a low heart rate, because of athletic endurance, is called good vagal tone, and it's a badge you can wear
Wow.
proudly. Yeah, it's a badge you can wear proudly. Now, that being said, if you're not physically very active and you're sedentary and you have heart rates of 45, 47, then I think you should see a doctor, because one of the commonest causes is like hypothyroidism can cause low heart rates. Any low heart rate which is associated with giddiness, feeling extremely tired, or fainting episodes, see a doctor immediately. As you can see, every time I come back to symptoms, right? Because
Yeah.
I'm not too keen on treating your heart rate. I don't want to treat whether it's 100. I want to treat when you feel unwell.
Wow.
So that way, so if you have symptoms and low heart rate, see a doctor. If you're fit, low heart rate, wear it like a badge. Simple.
Nice. Tell everyone what your heart rate is. That's what we should do.
It, yeah, it's
What's
about
yours?
50,
Yeah.
50, 50, 52. Yeah, it's good.
Awesome.
Yeah,
Awesome.
I know.
That's nice.
When
Nice,
I started, I remember talking to you a year back, and my heart rate was 80, Rujuta, resting. Yeah.
Wow. Wow.
So it
Wow.
takes a year, but it's worth it.
Awesome. So there are going to be many more people who are going to be truly, like, their hearts are going to be touched and healed by you now that, awesome. This is really good. This is really good. All right. Before we go, just two more questions. Do you have time for that? Can we do those?
I'm all yours.
How sweet.
I,
Thank
I
you.
feel so miserable that I was 4 minutes late. I'll be terrible. You won't be.
You can make it up to me. I'll devise
I,
ways of you making it up to me.
I will do my best to you and all the viewers.
But is it okay to drink when you have BB?
Okay.
Well, this is one person
Rajita,
called Kalpana.
what
Yeah.
are you doing to me? Who asked this question?
One girl
Why?
called Kalpana. Is it okay
Why,
to drink?
Kalpana? Why? Why did you ask me this
Yeah.
question?
Maybe we'll
Okay.
turn this around and say it's okay to drink water when you have BP.
Okay. So no. I'm not gonna sidestep the question. So here's it. Okay, Kalpana, when you have malaria, you have a fever. When you break a bone, you have pain. Half the people with high blood pressure don't even know they have blood pressure. So it's extremely important to, first of all, check and make sure that you have blood pressure and get treated for it. Now, almost all the bad effects of having blood pressure are because the blood pressure is high. So as long as you take your medication regularly and keep your blood pressure within normal limits, you're as good as anybody next to you. Whether you have hypertension or no, you're just taking a tablet, you're keeping it in normal limits, okay? Now, when it comes to alcohol, anything in moderation will not harm you. I can't say it's good for you, okay? Anything in moderation will not harm you, all right? So if you're telling me that twice a week, doc, I'm going to have 2 drinks, I'll say, please go ahead. If it makes you happy, if you enjoy it, go ahead. Don't feel guilty about it, but in moderation. But if you're going to tell me that, doc, I'm going to have 5 larges 4 days a week, I'm going to say, you are absolutely bat crazy. Please don't do it, because it will increase your blood pressure even further. Binge drinking is bad for you.
Good. Nice. And not drinking at all is great.
You know what? It is actually amazing, but I love my drink as well.
Yeah, you love your drink. It's fine,
But
But
the ideal scenario, as you grow older, the less you drink, the better you are.
yeah, I think in an ideal scenario, you should be able to say what you want to say without having a drink. I think that's the ideal scenario, right?
I am no match for you, my dear.
All right. Do you have any special tips for women who are above 30? Because they're like, okay, we are women above 30. Is my heart at a risk? Is there any age where we should actually just go and see a cardiologist, or should we wait for something to happen
No.
and then see a cardiologist?
So here's the thing, right? First of all, 30 is very, very young. Okay? Very young. Okay? But here's the thing. As long as you women are premenopausal, nature has built you in such a perfect way that your hormones protect you. Okay? The minute you hit menopause, you actually catch up with men on your propensity to get heart-related diseases, heart attacks, etc. Bearing that in mind, if you're postmenopausal, you have to be all the more careful. You have to check your sugar, you have to check your blood pressure. But having said all this, age is only a state of mind. Okay? If you exercise every day, neither you nor any of us will be able to tell how old you are.
Wow.
It is the elixir of youth, right? Eat right, maintain ideal body weight, okay, and exercise. At least with us men, you can tell how old we are. Damn hair falls off. You girls look lovely. So
You look lovely too.
just exercise and work out and get yourself checked. That is very important. Once a year, just do a routine master health checkup. And the beauty of exercising is that if you are short of breath, you will know sooner than a guy who doesn't exercise or a lady who doesn't exercise.
Awesome. Awesome. That's nice. That's nice. So you basically mean that there will be a baseline improvement in our health. So if anything goes off, we'll know faster.
Absolutely. Please suggest which oil is good for health. I do not dare answer that question with Rujuta opposite me. She will tell you. She will tell you have ghee, and she will tell you can have any oil you choose to have, any oil you're used to having, as long as you have it in limit.
Yeah, any oil, which really gives a nice tadka to your dal and sabzi.
Absolutely.
That's nice. It's like saying, who is the ideal guy to marry? Anyone who does that to your heart, right?
So sweet. So true. So true.
All right. Great. You've been wonderful, and we could go on endlessly with you, but we do know that, time is a resource that none of us are born with endlessly, and your time especially is just so precious.
It was good.
Thank you so much for spending this time with us.
It was a pleasure being here. Thank you for putting up with me, and sorry about the anxiety I caused the first 3-4 minutes.
Hey,
once
no
again.
problem. No problem.
But I love being here. Thank you all for listening in, and please take care of your hearts, take care of your health, and we'll wait for better times.
Yes, I also want to say one more thing to you before you go. I don't know if you read those comments, and people are in love with your smile. And there are people who are saying that your smile is exactly like your dad's.
Thank you. That's so kind. Thank you so much.
All right. Thank you very much. Hope to see you really soon.
Likewise, Rujuta. Thank you so much for having me with you. Take care.
Thank you. Thanks.
Bye-bye.
Bye. And thanks to everyone for joining us. You can follow Dr. Sai Satish on his handle now that you know where to find him. Thank you, and you have a good evening. Bye.
You too. Bye.
And now